Hi. Hello and welcome to Knock Knock Hi with the Glaucomfleckens. I am Will Flannery, also known as Dr. Glaucomflecken.
I am Kristen Flannery, also known as Lady Glaucomflecken.
Okay, it just sounds kind of better coming from you. Like you say Glaucomflecken better than I do. Mine sounds Glaucomflecken.
Glaucomflecken.
Yeah, but you have like a very like classy way of, as classy as you can say, Glaucomflecken.
Yeah, it's my dainty feminine
Glaucomflecken.
voice.
We are the Glaucomfleckens, and we are excited for you to hear this episode.
Yes.
You're going to hear me say this multiple times, how just thrilled I am to have this conversation with Maya Miller. She is an engagement reporter with ProPublica working on community-driven investigation. She specializes in health and environmental reporting, and she has been doing some amazing work, her and the ProPublica team, surrounding health insurance companies. Now, you guys, you see my videos, you know I love making fun of health insurance companies. United and the gang.
Mm-hmm.
They bring it on themselves for being terrible about everything. And so it's one of my favorite things to do. I love making those videos, making fun of them and kind of hoping to bring to light some of their issues, some of the things that they're doing around denials and privatizations. But Maya Miller and her team and the ProPublica team, they're taking it to another level. They are uncovering the some of the shady under the surface things that nobody really knows about, how many claims are denied, what's the process for denying these claims, what are your rights?
What are they saying internally at these companies when they're denying these claims?
And what are your rights as a patient? How do you fight back? How do you make sure you're being treated fairly? And the work they've done, they've had 3 investigative reports so far and more to come.
Yes.
And so I really, just right off the bat, want to encourage everybody to go to ProPublica and check out these reports.
I think
because it's illuminating.
The main takeaway, if you listen to this episode, for me was appeal your denials. Appeal. Because they're denying, well, you'll hear all about it. They're denying things they shouldn't be denying, and you have a course of action to take after that is available to you. So take it, please.
And I also want to just tell one quick story from my own experience. So I put out these videos where I call United Healthcare evil and Cigna and all these things. And I put out one about prior authorizations surrounding cataract surgery. This is about a year or so ago. And shortly after that, I got a message on Twitter from somebody who said that they know someone in the C-suite of a major health insurance company who saw my video about prior authorizations and held a meeting about it, like an internal meeting, like at the highest levels of this company, where the CMO was apparently furious and demanded that my video be taken down from the internet.
Demanded to their internal team that they take down.
I never heard any of this. They wanted the video removed, scrubbed from the internet, as we all know. Not how the internet works. But I found that it tickled my funny bone. I loved it. It gave me motivation to keep going and making videos and doing all this stuff.
It goes to show that social media advocacy gets attention. Yes, it gets the right attention.
Exactly. It gets the attention of the people that need to be aware of what they're doing to people. And so
one of the common themes I hear, from reading Maya's reporting was the insurance companies saying, well, we're not making decisions about your treatment. We're not making healthcare decisions. We're just making decisions about what we will pay for, which to anyone who knows anything at all about how American healthcare works is just such a nonsensical argument. It's just a straw man, because clearly healthcare is so expensive that no one can afford it without insurance. So by your insurance saying we're not going to pay for it, they are effectively saying you're not going to have this treatment.
Yeah. Well, we let's get to the interview because it's a long one. This might be a little bit of a long episode, but we loved it. We had such a good conversation that could have gone on and on forever. Fortunately, our producers tried to like push us along a little bit. So thank you for that because otherwise we get bogged down and talk about insurance company forever and our heads will explode. So
Mhm. Yeah,
let's
make sure you're not doing anything that you wouldn't want to be doing while very angry when you're
Nothing,
listening to
just
this episode.
slightly angry, frustrated, wanting to change the system, we'll say.
Yes, motivated.
All right, here we go. Here's Maya Miller. All right, we are here with Maya Miller. Maya, I cannot tell you how excited I am to do this. And the first question I have for you right off the bat, um, how happy is the health insurance industry with you right now?
Uh, that's a great question. Yeah, I would maybe not thrilled, but we've been hearing from a lot of patients and healthcare providers who seem pretty happy with our work right now.
Well, good. Well, we appreciate you. You're not in the ProPublica offices right now, which is it's probably much busier over there than where you are right now. But we really appreciate you joining us.
We
Yeah,
can
thanks for
relate
having me.
too to the insurance companies not being thrilled. I think
Oh yeah,
Will here has done his fair share of
I
provoking them.
well, I get asked a lot actually. Like, do they try to sue you or something? Like, are they like coming after you? Because I do these comedy videos and name them actually. Like, I'll have like name United, name Cigna. I think I have like the added protection of humor, like satire, right? So that I think that does give me some protection. You, on the other hand, I don't know, like how much animosity is? Do you feel that? Do you feel pushback from health insurance?
Yeah, that's a great question. So we do have lovely lawyers on our staff who,
That's good.
will probably listen to this too. So I'm going to keep them in mind. But
Sure.
they, read every single story that we write before we publish it.
Hmm.
And we're in the, practice of sending no surprises letters. So, weeks or even months before a story, as we kind of have gathered the evidence and think we know what's going on well enough, we write out a list of questions, write out our what we found, and then we send them to the companies that we're investigating and say, "Hey, would you hop on a call and do an interview with us so we can make sure to get this right?" And it's been interesting. Some companies are down to get on. Actually, I don't think any company has been open for a phone call yet, but they have been responsive to those emails, and then we of course have to include their response
Right.
in our story. So that's kind of how we approach that. But
Well,
yeah, no, we you know b- try to do our
good.
due diligence, of course, before we publish.
And you get some legal help there. That's probably
Exactly.
good. I don't think I need to take it that far, but maybe I should hire a lawyer. I don't know. Maybe you can give me a recommendation. But I actually want to go back to the beginning of this. And as someone in healthcare, I interact with these companies all the time, right? We're in it. And so how did you get to the point where, this looking into the practices of these health insurance companies kind of piqued your interest? What was the origin of this idea to go in this direction?
Yeah, so we've been teaming up on this work with Patrick Rucker, an amazing reporter with the Capital Forum. And last summer, he got kind of a good tip from a couple of sources, people who worked at insurance companies who've really helped illuminate some of this work, and who've also been some of the people helping us bring this all to light. Talking about how insurance companies do the work that they do, how they kind of track the cases, approvals, and denials. We'll have some more upcoming stories on that to come soon. And Patrick came to us, and we teamed up with him on that work, and just started. We put out a call out. So that's one of the first things we did. Is the best tips often come from people who are
Hmm.
within the insurance industry who have worked there. Healthcare providers like yourself who spend probably hours on the phone with insurers pretty regularly, and patients too who've been through these denials. And so we put that out, and we just got barraged with incredible and heart wrenching
Yeah.
tips. Really, people sharing their experiences with denials, people who've worked at companies or who've had kind of these like moral crises of not feeling like the work that they were doing was what they had signed up for or what they intended it to be. And so that really drove the work that we have been doing and that we're going to be continuing to do.
Yeah, that's when I first became aware that you were looking into this, because I helped to amplify the call for stories, and I was curious. I wanted to ask you exactly: did you get more than you bargained for? Is that like, were you surprised by the response to a call out on social media like that?
Yeah, so actually, so my specialty is I'm an engagement reporter, so I do community driven investigation. So often turning to the public for help with these kinds of longer term investigations. And I've been doing this work for 4 years now, and I think I've never seen the volume that I've seen with insurance denials. I did a series on hospitals suing patients for bills that are overdue, and even with that, we saw less of a response. So, I mean, it's been
Mm,
incredible. We've heard from thousands of people, and initially, it was a little bit overwhelming, but we set up a system to make sure we're reading everything, responding to as many people as we can, and everything that we do here helps inform our reporting and
yeah.
helps us identify themes. So it has been overwhelming, but I think that just speaks to how pervasive this issue is across the country. No one seems untouched by these denials.
Right.
Yeah. What kind of themes have you identified so far?
Yeah, so we've heard from people we've heard about denials in particular for certain types of treatments a lot. So we know that a lot of scans, MRIs, things like that get held up in denials and can lead to delays in identifying diseases that people have. Durable medical equipment is another one that we've heard a lot about denials.
Mm,
Biologics or specialty medications that are expensive tend to be caught up in the process. And from one of our actual stories that we did, we found that United Health for one of their patients like had a flag for this high cost care. So it seems like insurance companies are building that into the system to tag these high cost things that a lot of people really do need to live their day to day.
and so getting the stories is one thing, right? You have all this information coming in. And it really seems like your one of your goals for this investigation was to just uncover these shady practices, because it's these health insurance companies are so non-transparent. There's so much that the public just doesn't know about them, and that's what I found the most fascinating, reading through these. Now that I think it's three stories, three reports that have been put out there, is that you were able to get this in. So I wanted you to hear about how difficult it was to uncover some of this stuff.
Yeah. Yeah. So pretty difficult. I mean, we always start with a hypothesis, but since we've been getting so many tips, we're kind of now and have these themes, we're knowing what to look out for. And one of the things we're constantly looking out for is if people are able to get the paperwork behind the scenes, or we're really trying to understand what's happening behind the scenes. And with this story that I mentioned with United, there was a patient, Christopher McNaughton, now in his 30s. He has also pretty extreme ulcerative colitis, and he had, after 3 4 years of trying to find a treatment for him after his symptoms really developed, was able to kind of work with a doctor to come up with a good combination of specialty biologics that helped keep his symptoms at bay, and he was able to return to school. And he's, at United was covering his care, and then he noticed on his case it said pending. And so the family reached out and they're like, hey, we've been working for years to get this treatment. We want to make sure that it's still covered. They assured them that everything would be fine over a couple of phone calls, but then they saw that, checked in a little later and it said denied. And so very few people actually appeal denials in the United States. There have been some studies that have found that 0.1% of folks actually
Wow.
go through with these appeals, talking about, the difficulty of just navigating this process.
Yeah.
Yeah. Is that 0.1% of people with denials?
Yes, I think so. So
Wow.
there was a study that looked at people who have insurance through the marketplace, and that's where they find that
Mm,
0.1% of people with denials, I believe. But I need
yeah.
to
Yeah.
reread that study. But yeah, no, and so Christopher and his family went through with the unusual step of appealing, and after they got continued denials, they went through with the even rarer step of filing a lawsuit. And so very few people end up actually doing that. It's money, it's time, but Chris really needed the medication. And so once they were in the lawsuit phase, they were able to go into discovery. And that's when they got all the behind the scenes of, what the insurer was actually saying about the case. Was able to get a recorded phone call that United employees had about his case. And I think it was a peer to peer that had come back and was denied. And one of the employees started laughing when they found out, that it was denied. And they were like, that's exactly what we expected it to be. And so that's the
Yeah.
kind of thing where that's been, we're looking for is like sifting through court documents, or when patients are able to get their claim files, which is something we actually discovered through this reporting process too, is patients can request all of the files associated with their claim. But yeah, when it's not always easy to get, and it takes extra time. So it's been definitely a lot of work.
That was something that I didn't even know you could do. And something I've actually, told patients about now ever since you reported on that. So, that you can, well, I guess have you uncovered like what exactly the process is for
Well, you've written
requesting
a
those?
guide, right?
Yeah.
Yeah.
Yeah, exactly. Yeah. So
Yeah.
pretty much, and we're working on a form builder to try to make it a little bit easier for
Oh,
folks.
Oh,
nice.
that's
But
awesome.
essentially, you just need to input your claim information, the cost of how much it costs, and some more details about your claim, and then send it into your insurer. And legally, they're required to give you back all of the files associated with your claim. So that includes audio of phone calls that they've had about your case, things like that. We have seen some insurers stonewall, and we are working on a follow up story about that, because again, they're legally required to hand these things over.
Mhm.
But yeah, would encourage all patients and healthcare providers who have patients to encourage them to request this, because can help in crafting an appeal, first of all, but it could also just show the insurer that the person is listening, knows what they're doing, and puts pressure on them to like act in good faith a little bit.
Yeah, I think that these companies are really relying on people not understanding the process, and they're making the process as complicated and obscure as possible, it seems. So the more people can do like what you are doing, and even what Will does, to shed light on these tactics that are going on, and to shed light on exactly what is happening behind the scenes, and then what the processes are, that allow you to do something about it. I think that we need more of that, because that's one of the most powerful ways, I think, right now, that patients can get the health care that they need, is for these, shady practices that are happening behind closed doors to be brought to light.
Yeah, and yeah, I'll just do a quick plug too for anyone who is interested in learning more about the claim files. If you look up propublica.org/claim file, you can get all the information there. And we actually are developing some kits too to send around, so some pamphlets that people can have in waiting rooms or
Oh,
who
that's
lead support
awesome.
groups, for anyone interested.
That's great. I love that. And one of the more, well, talking just more specifically about the process of denials, because that's been something, one of the most frustrating things, obviously, not just for patients but for physicians as well, is uh, who is reviewing these claims? What are they seeing? What is their job? Why are they doing this? There's everything around the decision to make that denial. And in your second story about the Cigna system, that allows these physicians, which they call medical directors, to deny claims, it was shocking. The process that's being used now. Can you speak to that a little bit?
Yeah, absolutely. And I wonder if Jimothy will also make a appearance here.
Yes, he's taking notes.
Okay, great,
Absolutely.
awesome. Yeah, so we found through doing this work and through people coming forward to us with this information that there's a process at Cigna, and it appears that it was developed at United, the person who brought it over to Cigna, and potentially a couple of other insurers, in which they kind of have like a coding software. So if you send in your claim and it has a CPT code, that's one thing, and it doesn't match up with a list of different ICD-10 or codes that they think should be covered, then it will just automatically go to a medical director's into a kind of a system that allows a medical director to batch open all of the ones that have been kind of flagged in this way, and then kind of sign off and deny them in batches without opening a patient file. So, they had a tracking system and they found that it took 1.2 seconds to deny each of these claims. When we first saw that number, we were like, how is this possible? And then,
Yeah.
to really like make a decision about a patient's case in 1.2 seconds. And then as we discovered the system, we brought it to a lot of state regulators and we're like, is this legal? And, it's a little bit murky, but in a lot of states require medical directors who are making decisions about patient cases to be flexible, to be objective, to be thorough. That's the language that a lot of states are using. And so, I think it's open question if 1.2 seconds enables that kind of thoroughness that the state laws require.
I think it's very,
I think it's clear that
I
it
think
does
it's pretty
not.
clear
Yeah.
to everyone else, you know.
Right.
You have to have journalistic integrity and can't be
That's right.
objective about this, but
You can let me throw out
subjective.
all the insults. Yes,
That's right.
that's fine. You keep doing what you're doing because it's certainly making a difference. Have you were you ever able to connect with one of these medical directors? Because they seem like they're not even real people. Like who are these people? What is their path that gets them into these positions? And I'm so fascinated by that. So is that something you tried to kind of get into?
Yeah, so we've had the privilege of talking to probably dozens of medical directors so far this year, and last year a bit. And a lot of people got into this work it's a host of reasons. Some were actually burnt out, from just
Hmm.
being in day to day practicing clinical work. Felt like the system wasn't working and just needed a break from it, and felt that they could, still put their medical skills to use and try to help patients in this role. So there are some people who come into it with the intention of, oh, this is actually another way we can try to help patients and put our clinical use, our clinical skills to good use. And then, it's a job where you can work from home. The pay is pretty good and flexible. So I think,
Hmm.
people who are just for different reasons in their life, either they're caring for a sick parent or have a lot of children at home or something like that. It's a The people have told us they've gotten into this work because of that flexibility. It also seems like other people are just like they lifers in this work. We have found that some folks, like one of the medical directors in the United story that we chronicled, had, I think, last time he had practiced in clinical medicine was in the 90s, and then so he's been doing this work for a very long time. And again, I think it's a different host of reasons why people get into it, and it's interesting. Some folks are really, you know, certain that this is a helpful thing to do and an important role. Like they're like, if this is the way the system exists, I might as well try to be in it and help it from the inside. And other people, from seeing how the system works, are so disgruntled and then want to talk to a reporter and want to try to bring it to light so that there can be some system change.
Yeah.
And are medical directors required to keep up on, the latest advances in healthcare in the same way that practicing physicians are?
That's a good question. I do believe they have to be board certified, and I think so. I think you would need to probably maintain some of those testing requirements. But we have, one of the things that's interesting is, and again, I'm sure people who've been on phones trying to fight for their patients know this well. But you can be a neurologist talking, or a pediatrician trying to get care for someone and talking to a neurologist, and so there's also
Right.
sometimes a mismatch. Even if they are up to
Hmm.
date on all their specialties, they might not be in the same exact field as the kind of treatment that they're opining on.
That just blows my mind because you could never have a practicing physician doing, somebody who is board certified in neurology practicing pediatrics. Why do we allow for it in the people making decisions about what's covered and what's not?
Like, can you imagine like me making decisions about like someone's liver
God,
care?
no.
Like,
No.
that's so far away from the eyeball.
I know.
Like, I would never trust myself to do that. But also, they I'm sure they do have to have some kind of certification, but there are a lot of specialties. Oh, they don't do them anymore, but that a lot of doctors who have lifetime certifications in certain specialties. I think that's since gone away. But I think it's also fair to question, okay, they may have a certificate, but how
Relevant is it?
relevant is it
what they're
to
doing.
today's medicine, right?
Yeah.
And the decisions that they're making. And I feel like maybe insurance companies kind of hide behind this guise that, these medical directors are certified,
And
and
how can someone who, is in that situation or has board certification in a specialty that's not relevant to a case at hand, how can that person say that a treatment is not medically necessary? I see that theme a lot in your stories, that seems to be maybe the most common, I don't know, a common reason for denial. And it just seems like that person is often not qualified to make that decision.
Yeah, I think it's tricky in talking to these medical directors. I think, and some states do require that if you're reaching a peer to peer level, you have to talk to someone with the same specialty, but it's kind of a patchwork of state laws that regulates the system, anyways. And so, yeah, I mean, that's a great question. I think that one that a lot of people we've talked to grapple with, and that one that also like can lead to physician burnout from what
Yeah.
we've heard, because just like you're fighting for your patient. And I've talked to some healthcare providers who've been on the phone with folks at insurance companies who haven't even been able to pronounce the um, like drug treatment that they're trying to like prescribe for their patient that they're denying. And so I think that level of frustration and added administrative work can really grind on the people who are making the healthcare system work for patients.
Right. And the medical directors, rarely, if ever, have to actually see the patient and see the, deterioration that's happening because of all of the delays or denials or whatnot. It's the physician that, interacts with those people face to face. And there's just such a large, like, moral injury to all of this.
Yeah,
yeah.
yeah. I mean, it's not the most yeah, definitely, and it's not the most uplifting topics for sure.
You're getting us fired up
Yeah,
here,
I
I
know.
know, we're
I
Maya.
know.
getting
That's why
angry.
when you were like, "It's going to be fun," I was like, "Oh no, like it might not be." But
Fun is
yeah,
but I also have kind of a twisted way of looking at
Yeah.
things. So this is fun. We're having a great time
Aren't you
here.
having fun,
This is
everyone?
great. I think what I found interesting in putting out my, compared to what you're doing, my little silly comedy videos, it almost seems like ridiculous to even talk about. But the social media response, that's something that I want to talk with you about, in the response to your stories as they come out, because um, I find it interesting. You would think that putting out something like this, it's very critical, obviously, of you just read it, even if you're objective in your reporting, it's obvious to everybody reading it that these companies are doing terrible things. I've always find it surprising that you'll hear comments, you'll hear people that almost don't believe it, that they think, well, they're doing all this denial, they're reviewing all these claims, they're doing prior authorizations,
To protect
to protect
patients.
patients. And it's almost like a big PR campaign that insurance companies seem to be winning at times, that they're putting the blame either on physicians or on other areas where they're just there to protect patients. Have you ever felt that?
yeah. I mean, it's interesting. So that's something obviously we looked at closely when we were first starting out on this series. We wanted to like weigh all the evidence, really like, uh, you know, eh, take all the points and assess them, do our due diligence of doing that research, and we found that like the healthcare spending, that's the common argument, right? Is like we need the system, we need to tamp down on spending. There's a lot of healthcare providers who are doing unnecessary procedures on patients, and we're there to kind of stop them and stop fraudulent billing and practices. And yet, looking at the evidence, like we're actually spending more and have been increasingly. The graph is like this: like have been spending more on healthcare than ever before. And if you look at us compared to other countries, we're spending a lot more. And it's not like fraud is going down in healthcare either. We've My colleague, actually, Marshall Allen, who's now he now works at the Office of Inspector General's office. He left journalism to go kind of investigate on that side. Wrote a story a couple years ago where he went to insurance companies and said, "Hey, like, how many cases have you all referred to like different federal agencies or state agencies for fraud?" And the number was, I think, like 12, 13. It was pretty small. And so
Hmm.
if you're really, and they're dealing with millions, tens of millions of claims and cases. So
And
I
yet, how
think
many have been denied for stupid reasons? You
right.
know?
And yeah, and that's something that also my colleague Robin Fields wrote a story about. There's just also a lack of transparency, as you mentioned too, that there's very little data on denial. So it's very hard to kind of assess to, which company is the worst when it comes to denials, like how many denials are wrongful or get overturned on appeals. There's some data out there, but it's very messy and dirty. And so you can't really do a good faith analysis with it. But yeah, I think it's an argument that we've seen, but because we've done our research and our homework on that,
Mhm.
um, it just doesn't seem like that's the case.
What are the insurance companies required to put out there about their denials, if anything? Are there laws that require them to be transparent that they are violating, or do those laws just not exist?
Yeah, so my colleague is the expert in this, and so I don't want to misspeak, but I believe that there was a law, like under the ACA, that was passed that required the Department of Labor to collect information on denial data, and it doesn't seem like that's been being collected. States or state insurance commissioners are also collecting all of this data, but we went to every single state insurance commissioner and asked for it, and they were like, "No, sorry, you can't have it." So yeah, that even though it's a public agency, we expect it to be able to get it. But it seems like there's kind of just, hoarding or holding onto this data pretty closely so that, again, we can't have a good look into the system as much as we'd like.
Do you have any inkling why they are doing that? Do they offer a reason why you can't see it?
That's a I think that they just, said it's private information or,
Yeah, why would they?
something like that.
I mean, they're
Aren't
gonna.
they supposed to be?
Well, they don't want to. They don't want anybody to know anything about what they're doing. You know.
Well, the company sure, but
Yeah.
state insurance commissioners
Oh well, yeah.
should be helping.
Yeah,
Well,
yeah, you would hope, but
Yeah.
hopefully that data it becomes more transparent over time.
yeah.
We'll see.
How do we as in just anybody who's interested in advocacy work around this issue, what are the best steps do you think to take to help with all of this?
Yeah, I think that's a great question. I'm curious to hear what you all think too, just in your terms
Yeah.
of your day to day of working on this, but or touching this in your work. But I think we're trying to help bring everything to light is really helpful. So talking, unfortunately, like talking to reporters does really help do that. But if so,
Yeah.
even emailing us with your experience can be helpful. Suggest submitting your claim filer request, trying to get more information from the insurance companies. And I think, when we were working on that Cigna story about that, 1.2-second denial mechanism, we saw an internal Cigna presentation in which they estimated that only 5% of people would appeal. And so that was part of like the business presentation on this, implementing this system. And so I think insurers are banking on low appeal rates. And so if you
Hmm.
feel like you've been wrongly denied, like it's totally your prerogative to appeal that.
Appeal.
And while it can be frustrating and time consuming, it's a process that really helps. It's a time consuming and expensive process for an insurance company to have to deal with. So it could, if enough people do it, can make
Hmm.
them maybe second guess some policies they have on denying certain
Yeah.
conditions or treatments.
That's a shocking number. Less than 5%, I'm sure. It's
Yeah.
just,
Well, and just the fact that they're factoring that in to their that's disgusting. That's just disgusting.
what I think, from my experience on being so aggressively online and social media and everything, is stories are so valuable right now. And I mean, they have been for a long time, but on social media, especially, because you can get on TikTok, you can on Twitter, you can get on anything and talk about, put a personal element to this underlying issue. And I think from an social media advocacy standpoint, it's incredibly valuable to do that. We've done that with whenever I had my cardiac arrest back in 2020, we had all these surprise bills. And so, we were talking about that all the time.
Mhm.
And I think narratives matter, stories matter, because it puts a face, it puts a human element to all of this. And so I always encourage whenever I go, speak at places, I just like talk about, the issues you've had, the conversations you've had, if you can, with insurance companies. Just get more information out there, get more stories out
Yeah,
there.
sharing publicly, it helps, like I said, to just like shine a light on what's happening. And they are, for them to be able to get away with what they're doing, it requires there to not be attention on it. So
Mhm.
I feel like one of the best ways to combat all of this is to put attention on it.
Yeah.
And I
Yeah.
think what you're doing, Maya, and ProPublica, that's obviously a very effective way to shine some attention on it. You've been putting attention on it as well. But I think everyone, in this day of social media, everyone has some amount of public influence. And so sharing your story in whatever public way you have, the more people that do that, I think the more effective we can be at making this system work better for patients and doctors.
Yeah.
Yeah.
Yeah, it's been very interesting to see too. Like if you get, I don't know what we've been trying to figure out, what the system is too, but it does seem like if you complain enough and loudly enough on social media about a denial, it will get overturned, which is really interesting. Like,
Mm-hmm.
That is
um,
interesting. I mean,
yeah,
that's and it's so infuriating too.
right,
Mm-hmm.
right,
It's like why it's very clear what I think what insurance companies really still care about. Like they care about public image.
They do. Yep.
It's important to them, and for some reason, I don't know why they're so massive, and that you would think that they don't care what anybody says about them. But like you see it time and time again. People pile on to them on social media behind somebody's terrible story about an insurance denial, and sure enough, it gets fixed. Um, I don't know.
Yeah.
yeah.
Well, before we wrap this up, I just want to ask about, what resources do you know of, or would you like to share for people? Because insurance and dealing with your insurance company is so complicated, how can it be, is there something out there that makes it a little more simple for people? What are the steps they can follow? What are the places they can go to learn how they can appeal their denials, and what options are available to them?
Yeah, that's a great question. So, it's actually even appealing can be a little bit overwhelming. I think it's really dependent on the type of insurance that you have. But I'd say, if you jump on a search engine and type in the type of insurance you have and appeal, that should kind of, a lot of insurers do have information on how to appeal on their website. So, just say don't be intimidated by it. And then the other thing that I would plug is that, again, just submitting these claim file requests can be really illuminating and can help show you whether an insurance company is, what factors they're considering when trying to assess whether to approve or deny your case, whether it's gone through any of these automated kind of systems at the front end. So if you visit propublica.org/claim file, you can kind of get a guide for how to do that. And we're in the process again of building a form builder. So I guess, yeah, other than those couple of resources, again, I'd just say of the mindset of when you get something from your insurance company, it can be really overwhelming, especially if there's a dollar tag on it that will hurt your chances of being able to, pay rent or,
Mhm.
put food on the table or anything else that you've been trying to save up for. And so I think just not being intimidated by that and knowing that you have options and rights is the thing I'd say is the most important.
Yeah, rather than just immediately writing the check and paying the bill, you
Well,
Yeah.
might want to.
that's the other thing. You get, speaking from our experience,
Yeah.
it's never just like one bill.
Right.
You get just every like week you're getting something, and it's from either a different hospital or a different physician, or depending on
And you don't even
contracting.
know
And
who all these organizations are, right? Like maybe some other third party was billing you
yeah,
for your imaging, but then you had this other. I mean, it's just so
and
obscure.
and do have I paid that one already? Wait,
Right.
no, this is just an explanation of benefits, but it
Right.
looks like a bill, but it's
Right.
not. It says it's not a bill. So
Right.
but this just speaks to how complicated it is and how overwhelming it would. I mean, it's almost overwhelming for me as a physician.
Right.
I can only, imagine what it's like for someone with no medical training whatsoever who is experiencing this for the first time. So,
So this is certainly not legal or medical advice, but just speaking as people who have had a lot of experience dealing with our insurance companies, I would encourage people, don't just like reflexively pay that bill. Look into it first, see what your options are.
yeah.
You may not actually owe all that money,
Yeah, you
in
never know. I
reality,
mean, if there are mistakes in billing,
Yeah.
that kind of thing
and you can
happens.
appeal.
So just, I guess, I think the lesson is just be diligent and aware and questioning.
Yeah.
That's
Always question. Yeah.
Always question. Absolutely.
Be the squeaky wheel.
Well, I want to know, Maya, let's take a quick break and then we'll come back. We could just talk about this for like forever. So
this gets us hot.
we'll be right back. Hey, Kristen, have I ever told you about Demodex?
I'm afraid.
The little eyelid mites.
Oh gosh, no, don't do that.
I'm just saying, if you've ever had red, itchy, irritated eyes, it could be Demodex blepharitis.
You might have some little friends on your eyelids.
They're not quite this big.
Well, that's comforting.
To find out more, though, you can go to eyelidcheck.com. That's EYELID check.com to find out more information about Demodex blepharitis.
Don't freak out.
Get checked out. All right, we are back with Maya Miller of ProPublica. And one thing I wanted to ask real quick before we get into a game that will be very exciting and fun for everyone is where are you going next with this investigative series? I'm just dying to know. How much can you tell us?
Not that much, but I will say definitely stay tuned for more stories to come.
You're going to keep going, though.
Yeah,
right?
We're definitely going to keep going. Right. We have at least through the end of the year, if not more. We've heard a lot of great tips, good. And we welcome more tips too. So if anyone is listening to this and is like, I've had an experience to share that I've with an insurance company or I've worked at one, we're here to listen and just really factor that into our investigation. So we have at least, I'd say like 2 or 3 more big stories coming up, and if not more. And yeah, keep the tips coming so we can keep reporting on this.
You've done 3 reports. If you could just do like 30 or 40 more,
that'd be great.
It would be fantastic.
Yeah, no,
if you want to get into prior authorizations, I'm not gonna complain about that. And neither will anybody else. So just throwing that out there. Anyway, all right. So we have a game here. It's called That's Too Much. That's Too Much. All right. So it's kind of like a Price is Right game.
Mm-hmm.
And so I'm going to lay out a scenario or a question, and basically whoever we'll do it different ways. Either sometimes I'll ask Maya, sometimes I'll ask you, Kristen, and I'm going to be saying different numbers and of escalating, in size. And so once I get to a number that you think is too much for the question I'm asking, you're going to say, that's too much.
So we're trying to guess how much it costs by way of telling you when you've gone over the cost. Or number of things.
Yes, exactly. Okay. All right. So I'm going to give this one, because Maya probably already knows this, so I'm going to give this one to you, Kristen.
Okay.
According to ProPublica reporting on a physicians group suing patients, this is in 2017, the disclosed value of private equity healthcare deals exceeded...
Wait. Private equity healthcare deals, meaning...
all of the deals that private equity has done...
to purchase healthcare
as
practices?
of 2017, yes.
Okay.
Total how much?
Oh.
All right.
Okay.
1 billion, 15 billion, 32 billion, 68 billion. Is that too much? 100 billion.
Okay, I just wanted to hear all my options.
You can't. That's not how the game works.
Okay.
Once you,
I'm sorry. I just first round, practice round. Okay, 68 billion. That's too much.
Correct. 68 billion was too much. The answer was 42 billion. 42 billion. This is in 2017, so I'm sure it's probably a lot more now. I don't know, Maya, if you know the exact figure of that.
That's a lot, unfathomable amount of money to me.
I mean, when $1 billion is your starting point, and they're just going to get bigger from there.
Exactly.
Jeez.
All right.
So private equity has paid $42 billion.
At least it's got to be much more now. So in fact, somebody listening probably knows the right answer. Now we're 6 years after that number, so it's probably, I don't know how close it is to 100 billion, but it wouldn't shock me. Okay, Maya, this is for you. Patients who are covered under the Medicare Part D plan now have an out-of-pocket monthly cap for their insulin. The cap is $15, $20, $30, $40, $50.
Too much, maybe?
It was too
$50.
much after 40. The answer is
Okay.
$35. $35 now is the out-of-pocket monthly cap for insulin. That was a huge win
Yeah,
for Medicare Part D.
definitely.
I was expecting you to start in the hundreds for some. That's just like shows
Well,
you my jaded.
Yeah.
Exactly.
Well, is it jaded or is it just, factual?
Tells you a lot
Evidence-based.
about U.S. healthcare that we all thought it would be a lot higher, right?
Yeah.
Actually, and that actually brings me onto another question for you. How do you maintain your own? Because you're reading so many horrible things, right? About people sending in messages about all these denials and everything. The price of prescription medications, I'm sure, is a big part of that as well. How do you maintain your sanity and without getting burned out by all of this? Are you taking care of yourself, Maya?
Yes, definitely am. Luckily I'm working with some awesomely talented reporters, and we all share the load and talk through it.
Good.
And then I also
Okay.
love to go running, and everyone should go to therapy as well, which is helpful too.
Yes. Shout out to therapy. Okay. All right. Let's do another one here. All right. Let's give this one to, let's see. How about Kristen? You try this one.
Okay.
According to ProPublica reporting on rejecting health insurance claims, Cigna doctors used a system to instantly deny requests for payment without opening patient files. We talked about that. Over a 2-month time span in 2022, 2 months, Cigna doctors rejected how many claims using this system?
Okay.
50,000, 100,000, 250,000.
That's too much.
What do you think, Maya?
That's not too much.
I think it was over 300,000.
Over 300,000, yes. 300,000 claims were denied in 2 months. And that's just Cigna, by the way. Like, this is, I have to imagine, we probably don't know for sure. The other, like Blue Cross, United, do we know what kind of system they're using? Is it similar? Is that information we know for sure at this point?
Yeah, that's a good question. We know that, so the person who came to Cigna and help get the system up and running to do these very quick denials came from United, and so we have good reason to believe he started that at United and brought that over. And then we've heard about a couple of other insurers using it, but that's actually, since we've published, a congressional committee is now investigating this, and they're trying to find out, how many other insurers use a system like this. So stay tuned, and we will know more hopefully soon.
Good. All right, Maya. What is the cost of a vending machine Diet Coke from my local outpatient surgery center? 75 cents. $1. $2.
Too much.
No, it's $2.50.
Really?
Oh.
$2.
Wow.
Yes.
That's pricey.
It's pricey, right? I mean, not to the scale of some of the other things we're talking about, but still very important. Doctors, everybody, healthcare workers, they need their Diet Coke. Okay, that was just a fake one, really. I mean, that was true, but anyway, let's do one more. Here's the last one.
Okay, who's it for?
This is for Maya.
Okay.
All right. In the Bill of the Month NPR series, a patient was billed what amount for an air ambulance ride from the University of Colorado, near Denver, to Duke University Medical Center in Durham? That's a long
It's a long
ride.
way.
It's a long ride. All right, how much was the patient billed for that? 150,000. 250,000. 350,000. 450,000. 550,000.
I'd say 550,000.
Yes, that is too much. The answer was $489,000.
Right in between. Wow.
For an air
Just
ambulance
to
ride.
get to the healthcare you need.
Yes.
Obviously, there must have been something very specific about Duke that made them go that
Correct.
far. So just to get to where you needed to be.
And
what kind of person has that money?
And I shudder to think what insurance covered for that.
Yeah.
I don't know.
Yeah, we've seen a lot of those surprise bills out of air ambulances, the helicopter rides.
And a lot was made over with surprise billing. Speaking of that, of the No Surprises Act. Mm-hmm. But I feel like I still hear a lot of stories from people that insurance companies are kind of skirting around it a little bit or figuring out ways to still treat things as out of network. I don't know. I think it's helped, but I'm dubious, I guess, that insurance companies,
Are not still doing things
they're
like that.
right, are still kind of not doing what they're supposed to be doing.
Right.
That's a good tip. We'll have to look into that.
Yeah.
Yeah.
Yes, please
check it
do.
out. That was the game. That was the that's too much.
I think it's all too much is what we have learned. It's all too much.
It's all too much. So Maya,
Everyone go to therapy now. You're welcome.
And don't have a Diet Coke anymore to help it make you feel better. Yeah.
Let's take one more quick break and then we'll come back and wrap things up. All right, we are back with Maya Miller. So the last thing we're going to do here, Maya, is have you listen to one of these medical stories that was sent in by our listeners. We'd like to share these with our guests and with our audience. So first, actually, we have one story here today. This is from an anonymous listener. I am a certified pharmacy technician, and I listen to the podcast about the leeches. Don't worry about that. We talked about leeches. Just leave it at that. I work in retail, but one of my friends had recently switched to hospital pharmacy at a local university hospital. It was her second week on the job, and she loved it so much and would send me Snapchats of all the cool stuff she was getting to do. One day, I got a text from her that said, "You need to check your Snapchat immediately." As soon as I opened it up, I see a picture of a live leech in an amber vial, like a pill bottle, with the caption, "I never thought I'd be delivering a live leech to a hospital floor in my career, but here we are." I believe it went to surgery, if my memory serves me correct. And I can safely say I have seen a live leech being dispensed at an inpatient pharmacy. So, Maya, how much did the live leech cost? $5. No, I have no idea what the going rate for
That's
a leech
a good
is.
question. Yeah, now I'm curious.
Hopefully,
Someone
like
tell
more,
us
I think
in the
more than
comments.
the Coke, like at least double that. Yeah.
Yeah.
Yes, I hope so. I also wonder if that's reimbursable. We actually have
Well,
learned.
and did the leech get paid for its
Right.
contribution to patient care?
I imagine it probably did not survive, but it got a nice meal
Yeah, there
before
you
it went away. We actually learned, Maya, that you may be interested or maybe not interested at all, but leeches are actually still used in medicine today in very specific situations regarding like skin grafting and in like plastic surgery,
Vascularity is
vascularity, things like that. So hey, the more
that's
you know.
fascinating. That is very interesting, actually. Is it pretty rare for them to be used?
I don't think it's common. I can't
I think
imagine.
it's very specific now.
Yeah.
Like it used to be used a lot more widely, but
I don't
now
use them
it's-
on the eyeball, so I have limited knowledge in this situation. But other people can tell us. This is like the third episode we've talked about leeches.
I know people are
think.
really fascinated by them.
Yeah. Anyway, if we have a leech specialist listening, please get in touch with us. Well, Maya, thank you so much. It's really been a pleasure talking with you. I've just been dying to have this conversation, and I just want to say how thankful I am on behalf of the entire medical community, because every time you come out with a report, I share it all over social media, and I know that people really, they get mad, they get angry, but also there's like relief,
Mobilized too with that
and
anger.
that somebody's looking into this, that information is getting put out there, and these shady practices are being exposed. And so you have the entire medical profession behind you in terms of, continuing on with these investigations.
Yeah, well, no, thank you so much. And thanks so much for amplifying the work. It's really, really been helpful in terms of connecting with more insiders, with more patients and healthcare providers who've helped us, do these stories and find them. So, really grateful for you all for having me on and for continuing to, help us get this work out there.
Absolutely. And I want to make sure that we kind of reiterate some of the really important things out there. So they can obviously find these reports on ProPublica.
That's right. Yeah.
And then you also you're designing those kits for healthcare professionals, patients who lead support groups and other patient advocates that can help them, file a claim request with an insurer. That's really important to remember. And there's a sign-up process. Is that right?
Yeah. If you want a kit, we'll mail them out to you. And if you also want to just tell us about how your claim file request experience goes, or share the records that you got back so we can also have a peek under the hood with you. Everything you can find everything at propublica.org/claim file.
And can
Awesome.
people share with you anonymously?
Yes, absolutely. Yeah.
All right. And then are you on social media?
Yes,
I think you are, right?
I'm on Twitter. I guess X. I don't know if it's X or Twitter now. As of today, probably
Was
gonna.
it today?
I don't know how long I'll be on it for, but
Yeah.
I'm
Sure.
on Twitter at Maya T Miller. So feel free to follow me there, and I'll post about our most recent work there too.
Awesome. Well, thanks again.
Yeah, thanks for having me.
Take care. Well, I am fired up.
Yeah.
I'm ready to run through a brick wall. And probably
Please don't.
and get severely injured.
But then we would have more insurance bills.
Oh my God, that'd probably get denied. I don't think there's
Yeah.
a CPT code. Did I say CPT?
You don't even know anymore.
Chat GPT, CPT.
ICD.
ICT. What am I talking about? No, CPT codes are a thing. ICT.
ICD 10.
Oh my God.
Billing. There's
The
no billing
point
code.
is, there's no billing code for running through a brick wall because you're angry about an insurance company doing what they do. But that was awesome to have Maya Miller on.
Very enlightening.
Man, gosh, just horrible things about the U.S. healthcare. There's bad things about every healthcare system, but it seems like we got a lot of them. So,
Yeah. They're doing important work by bringing all of that to public attention. That's for sure.
And God, definitely reach out to
Yes.
her and the ProPublica team if you have like really good stories, or really anything. You know, they're so good about using that information to kind of springboard into investigations of all these companies. So.
Yep.
And let us know what you thought of this episode. We'd love to hear it. This was such an enlightening, intriguing conversation. So we want to know what you think. There's lots of ways to hit us up. Email us, knockknockhi@human-content.com. We're on all the social medias, and kick it with us and our Human Content Podcast family on Instagram and TikTok at Human Content Pods. Also, did you like the game? What did you think of the game?
Oh, it's fun.
That's too much.
Yeah.
I know that there are some Price is Right connoisseurs out there. If you have, if there's like a Price is Right game that we could turn into,
I want to
a
do the one where you
podcast
get
game,
to spin the big wheel.
that would
But
not.
we would need a big
We
wheel.
would need a big wheel, and that would be hard for an
I
audio
just think
format.
it'd be fun.
But if you watch us on YouTube, it would work because we are there as well. I post an episode every week on YouTube. We also, I want to shout out our great listeners leaving feedback and reviews. If you subscribe and comment on your favorite podcasting app or on YouTube, we can give you a shout out. Like Big Fan 001 on Apple said, Dr. Fitzharris was amazing. She really was. She was fantastic.
I mean, we're still talking about her episode in this one. The leeches came up.
Yes, best interview to date. Please bring her back. Her energy is infectious. Love the podcast. Keep up the great work. Thank you, Big Fan 001. Big fan. I think more of a big fan of Dr. Fitzharris.
Seems
than a
like
big
it.
fan of me. And that's okay.
That's okay. We'll take it.
That's all right. She has got a lot of big fans, including us. Again, check out YouTube for video episodes. We also have a Patreon. Lots of cool perks, bonus episodes where we react to medical shows and movies. Hang out with other members of the Knock Knock High community. We're growing. We're a big community now. We're like a small town. It's great. You get early ad-free episode access, interactive Q&A live stream events, a lot more. Patreon.com/Glaucomflecken or go to Glaucomflecken.com. Speaking of Patreon community perks, new member shout out to Beth, Heather S, and Angie M.
Hello.
Welcome. We're happy to have you here. Shout out as always to the Jonathans, a virtual head nod to you all. Patrick, Lucia C, Sharon S, Omar, Edward K, Stephen G, Roskbox, Jonathan F, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, Dr. J, Chaver W, Jonathan A, Leah D, KL, Rachel L, and Ann P. Thank you all. Patreon Roulette, shout out. This is someone who's on the emergency medicine tier. Shout out, let's see, drum roll. Shout out to Paul S for being a patron. Thanks, Paul. Thank you all for listening. We're your hosts, Will and Kristen Flannery, also known as the Glaucomfleckens. Special thanks to our guest today, Maya Miller. Our executive producers are Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brooke. Editor and engineer Jason Portiz. Our music is by Omer Vizvi. To learn about our Knock Knock Highs program, disclaimer, ethics, policy, submission, verification, licensing, terms, and release terms, you can go to Glaucomfleckens.com or reach out to us, knockknockhigh@human-content.com with questions, concerns, or anything else you want to talk about. You want to bare your soul. Just tell us about yourself. We'd love to hear it. Got jokes? Got stories? I don't know. Tell us. We want to hear it. Knock Knock High is a human content production.
Knock, knock. Goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.